Assalamu alaikum, myself Dr. Jawad. Welcome to the PharmaCos YouTube channel. Today in this video, we will discuss the list of emergency drugs and their uses that are being maintained in crash cart trolley in hospital in worldwide. These crash carts are maintained for emergencies affecting patients and which are extremely important for normalized and stabilize the patients. The choice of drugs may be different from hospital to hospital and it will be solely dependent on hospital formulary and critical care in charge. Injection adrenaline. Injection adrenaline belongs to a class of sympathomimetic agents. It is main drug used in an event of cardiac arrest. It treats anaphylactic shocks and can also be used to control superficial bleeding. It may also be used for asthma when other treatments are not effective. Injection atropine. It belongs to a class of parasympatholytics or anticholinergic agents. It is used to treat bradycardia. It also acts as antidote for organophosphate poisoning. It is also used before the surgery to reduce salivation and bronchial secretions. Injection noradrenaline or norepinephrine. It also belongs to a class of sympathomimetic agents. It increases heart rate and is also used to treat critically low blood pressures. Injection calcium gluconate. Injection calcium gluconate is used to treat hypocalcemia, hyperkalemia, and magnesium toxicity. Injection sodium bicarbonate. Sodium bicarbonate is alkalinizing agent. It is primarily used to treat severe metabolic acidosis, generally if the pH is below 7.1. It is also used to treat hyperkalemia. It can also be used as an antidote for tricyclic antidepressant overdose and cocaine toxicity as well as other poisoning. Injection amiodarone. Amiodarone is an antiarrhythmic medication. It is used to treat or prevent a number of types of irregular heartbeat. These includes ventricular tachycardia, ventricular fibrillation, and wide complex tachycardia. It is also used to treat atrial fibrillation and paroxysmal supraventricular tachycardia. 25% dextrose or sometimes 50% dextrose. It is used to treat hypoglycemia. It is also used to treat hyperkalemia, that is high blood potassium. It is also used to treat diabetic ketoacidosis. Injection nitroglycerin. Nitroglycerin belongs to a class of vasodilators. It is used to decrease accelerated hypertension. It is also used to decrease chest pain, which is also called angina pectoris. Injection Succinylcholine. Succinylcholine is neuromuscular blocker agent. It is used to induce short-term paralysis, which will facilitate tracheal intubation in case of emergency. Injection dopamine. Dopamine acts as stimulant drug and it is used in the treatment of severe low blood pressure, slow heart rate, and cardiac arrest. Injection dobutamine. Injection dobutamine is used to treat heart failure, which is caused by cardiac surgery and septic or cardiogenic shock. It can also be used in case of congestive heart failure to increase cardiac output. Injection furosemide or Lasix. Furosemide belongs to a class of loop diuretics. It is used in the treatment of acute and chronic heart failure and in other cases of fluid overload. It is also used in the treatment of hypertension and hyperkalemia. Injection Lidocaine. Lidocaine is an antiarrhythmic and local anesthetic. It is used to treat irregular heartbeat that may signal of possible heart attack. It is also used for the treatment of ventricular arrhythmias that is due to acute myocardial infarction, digoxin poisoning, cardioversion or cardiac catheterization, if the Amiodarone is not available or contraindicated. Injection adenosine. Injection adenosine is used to revert supraventricular tachycardia. Injection hydrocortisone. Hydrocortisone belongs to a class of corticosteroids. It is used to treat severe allergic reactions. It is used to treat certain autoimmune disorders such as condition of skin, asthma, and other lung conditions. Injection vasopressin. It is used to treat critically low blood pressure in adults in case of shock in those cases in which even low blood pressure after receiving fluids or medicine in an attempt to increase blood pressure. Injection vasopressin usually is last resort to increase the blood pressure. Injection midazolam. Midazolam belongs to a class of benzodiazepines. It is used for emergency treatment of prolonged seizures. Injection naloxone. Naloxone is used as an antidote for opiate overdose. Injection diazepam. Diazepam is also belongs to a class of benzodiazepines and it is also used to control prolonged seizures. Injection paracetamol. Paracetamol relieves fever and mild to moderate pain. Injection methylprednisolone. Methylprednisolone is used to treat severe allergic reactions and immune system disorders. Injection heparin. Heparin is used to treat or prevent the blood clots. It is also used to treat or prevent blood clots in lungs, legs, and including clots seen in patients of atrial fibrillation. It is also used to treat certain blood clotting disorders. Injection aminophylline. Aminophylline is a bronchodilator. It is indicated for the relief of bronchospasm associated with asthma and COPD. Injection phenergen. Phenergen has strong anticholinergic properties. Injection phenergen or promethazine is used for sedating the people who are anxious or agitated. It is also used to reduce nausea and vomiting and severe allergic reactions, that is anaphylaxis, and also used in blood transfusion reactions. Injection dexamethasone. Dexamethasone is used to treat allergic reactions, asthma, and chronic obstructive lung diseases, that is COPD. Injection darifylline. Darifylline belongs to a class of drugs known as xanthines. It is used to treat asthma, difficulty in breathing, wheezing, and chest tightness. Injection Avel. Avel is an antihistamine used to treat allergic reactions. Injection ethamsilate. Ethamsilate is an anti-hemorrhagic agent used to prevent or the stop bleeding. Injection Flumazenil. Flumazenil is used to reverse sedative effects of certain medications such as benzodiazepines. Injection potassium chloride. Potassium chloride is used to treat hypokalemia. Injection digoxin. Digoxin is used to treat heart failure and irregular heartbeats, that is arrhythmias. Injection PAM or Aldopam. It is used to treat organophosphate poisoning. Injection mephentermine. Mephentermine is used to treat hypotension. So these are the list of the emergency drugs which are commonly used in the emergency department of the hospitals.